Hey folks, it's Patriot Nurse. Thank you so much for joining me today. In this important video, we're going to discuss a simple way, 5 things to remember to protect yourself from medical tyranny. This is an acronym that actually I picked up working as a nurse in the birth world, and it's fairly common in the whole pregnancy, childbirth world. But this acronym is something that can help anybody keep their head in the midst of coercion and threats from the medical industrial complex. Whether you're a patient and you're going to see a healthcare provider and you're not exactly sure where they stand, but you just don't feel right, if you can remember just these 5 simple letters that form the acronym I'm about to tell you, you're going to be able to navigate your way through it. And this acronym is B.R.A.I.N, B-R-A-I-N. Whenever you feel like you're starting to get backed into a wall by people, remember to use your brain. So B.R.A.I.N, it stands for benefits, risks, alternatives, intuition, and then nothing, or my favorite perspective is no. N for no. That was one of my favorite words growing up. Do you resonate with that? So let's talk about this and let's unpack it, because in order for you to shield yourself from these people, you do want to use your brain. And also you want to be able to articulate for whoever may need to hear your thoughts. You want to be able to articulate how it is that you came to the conclusions that you have. Let's talk about informed consent and why informed consent necessitates using our brain, B-R-A-I-N. Informed consent is something that is kind of given lip service to in the medical industrial complex. It certainly was in the College of Nursing that I went to. But as far as its lived out practicalities over the past certainly 3 years, that has really fundamentally changed in the way that it's lived out and walked out, and really the way that healthcare providers view themselves in relation to patients. So informed consent means that the patient is given information satisfactory for them to be able to make a decision of their own consent in a way that has that has them informed of the benefits, risks, etc. But the thing is, in order for someone to have informed consent, a person has to be able to ask for more input, has to be able to ask the healthcare provider for more information without fear of retaliation or feeling coerced. Coercion is the opposite of informed consent. And coercion, unfortunately, is the backbone of tyranny, whether it's in the medical community or whether it is in totalitarian governments. Coercion is something that is in stark contrast to what we would desire in an ideal circumstance in informed consent. So brain. Whenever you're using your brain, shielding yourself from medical tyranny, B, the benefits, R, the risks, A, the alternatives, I, your own intuition, and then N, doing nothing or no. So benefits. Whenever you're talking to a healthcare provider and they want to offer you, whether it is a pill or a drug, an intervention, a surgery, some type of move into your body and into your life, the first thing that we should ask is, what are the benefits of this? What's the benefit of this procedure? Is it going to offer me something I don't currently have? How is it going to give me an enhanced functionality that I don't currently possess? Whether this is a pharmaceutical, whether this is a surgery, whether this is an exercise, any type of intervention, you want to know very clearly what the provider says the benefits are. Then risks. Now this one is important. R, the risks. So risk is more than just a function of more or less risky for you to do X, Y, and Z. You have relative risk and absolute risk. And this is an important thing to wrap your head around. When a healthcare provider says, oh, if we don't do this, then it's going to increase your risk of X, Y, and Z. Meaning, if you don't have this surgery, it's going to set you up at an increased risk of, I don't know, heart disease, for instance. Or if you don't do this intervention, then it's going to increase your risk for infertility, or God forbid. Go right on down the list. Risk is more than just, oh, if I don't do what you're telling me, then I'm going to be at a greater risk for things I don't want. Risk is an absolute risk factor as well. Absolute risk, in simple terms, is I want to know solid numbers, solid data on exactly what the numbers are that you're using to substantiate the greater than, less than, more than, less than scenario you're presenting me with. So for instance, one of the things that is often touted in, for instance, the pregnancy world is the relative risk associated with different women across the lifespan and their risk factors for having children or pregnancies with various different complications. And so what they'll do oftentimes oftentimes is offer you drugs or interventions or whatever to decrease your risk, right? The risk. But the better question is, what is the overall risk, right? What is that objective number here? Are we talking that my risk factors, if I do nothing, are 1 in 10,000, and if I do something, it's 1 in 10,500? That relative risk and that objective risk, it's an important thing to know. So having solid numbers behind what they're claiming, that is something that you are owed as a patient in getting informed consent. You are owed solid data. You are owed a reference. If they are telling you that it's risky if you don't do something, or it's more risky if you delay, or you are owed some data and some statistics that really back up what they're saying. And if they can't provide that to you, that is not informed consent. So again, benefits, risks assessment. And also, think about it this way. There are risks both ways. There are risks with inaction and risk with action as well in some cases. So weighing those out, the absolute risk in terms of what is the absolute risk of inaction and the absolute risks in case of action. For instance, the risk of, rolling up your sleeve and looking at the risk factors associated with catastrophic side effects. For instance, one of the things that you see with flu shot that is listed on the warning labels is that flu shots do increase the risk of Guillain-Barré syndrome, and there is a risk factor associated with that. So having an idea as to increased risk and then absolute risk as to what quantitatively increases that risk. So let's talk about A. A is for alternatives. What are the alternatives that I have here? There is particularly this drug that you're offering me, the only one like it, or is there a less invasive, less risky one that maybe we could choose? Is there an herbal alternative to this pill that you want me to take that maybe has fewer side effects? Is there an alternative, for instance, physical therapy activity I could do instead of doing surgery? Alternatives are an important part of this equation to really help wrap your head around what are your overall options. Alternatives are a very, very valuable thing to ask about. And really, a lot of healthcare providers, particularly if it's in surgery, they're trained to essentially play on a couple of strings, and that's it. If they are a surgeon and they do med surg, then they're probably not going to be able to offer you a whole bunch of alternatives because they really, for the most part, don't function in that world. You may have to ask for alternative healthcare providers, alternative modalities. So for instance, chiropractic as opposed to like straight up lumbar fusions or something like that. Alternatives are an important part of this equation to help you remember where your options are and where you're sitting at. Here we are. Intuition. This is an important one. Your intuition is your gut feeling. That is no less of an important factor in your informed consent than data and numbers and objective stuff that make people with white coats really, really happy to talk about, or not so much. Your intuition, what you feel as a patient about what they're telling you and about the procedure, do not negate that. If, for instance, there is a procedure that a doctor is pushing on you or a drug that they want you to take, I'm thinking about things related to, for instance, cholesterol medications, blood pressure medications. If you have a bad feeling about this, or you do not, let's rephrase this. If you do not have peace about this, if you don't have peace about that, you listen to it. Your intuition is a very, very valuable component of your overall informed consent. And if you don't feel right about that, you have the right to refuse that intervention as part of your informed consent. So I for intuition. Remember brain. Use your brain. B.R.A.I. And here's the last one. In. Now, in terms of how we practically apply this can mean various different things. Not right now, the risks and benefits of doing nothing, and also just flat out no. I love in being no. What if I can just say no right now? And I say, no, I'm not quite ready for this. Let me think about this. Or if we don't do anything, if we do nothing, what are we looking at here? Is this an emergency? And that's really a way to rephrase this. What is the cost, so to speak, of doing nothing? Do we have time to act upon this? Do we have time to reflect upon this? Can I pray about this? That's one of my favorite ones, actually, because again, if your intuition, thinking back to the previous one, is not giving you the warm fuzzies and you don't have peace about something, you have every right to ask the healthcare provider who is giving you this option in front of you, hey, is this an emergency? Do I have to act right now? Is this really a clinical emergency? Because if it's not a clinical emergency, then I'd like to just take a moment here a couple hours by myself, day or two, talk it over with my spouse, pray about it. We're just going to sit here for a while. Or if you don't feel like it and you're not feeling that this is a good intervention for you, you can totally say, no, thanks. No is a complete sentence, especially when it comes to people trying to do things that are going to alter your body or put things into your body or perform interventions that could potentially drastically change the functionality of your body. You have every right to say no. So in total, all you have to remember to deal with the medical industrial complex and to shield yourself from tyranny is BRAIN, B-R-A-I-N, benefits, risks, alternatives, intuition, and no, or nothing. This hopefully, I pray, will help you wrap your head around informed consent and that you really do have the power. You have the power to refuse or to receive or to modulate your own plan of care. You own your body. Nobody from the state and nobody with a white coat gets to tell you what to do with it. And unfortunately, because of the way that things are going, there's more and more coercion, there's more and more soft pressure tactics that are being used, and now we're moving into a place where there's more and more overt threats of involving court systems to try and take children from their parents and things like that. And let's be clear, various different healthcare organizations, alphabet soup organizations, I believe including ACOG, the American College of Obstetrics and Gynecologists, they're very open about the fact that coercion is a problem in the medical industrial complex, including threats of involving the court systems to get babies taken away, God forbid, from their parents if the parents don't want to do an intervention, or the pediatrician's office is another place where this is unfortunately becoming a problem, and even in elder care as well. If you want to embrace alternative and holistic methodologies and you have a parent, an elderly parent who, for instance, is charged with your care, we're seeing more and more of the courts being used to facilitate tyranny that is being perpetrated by the medical industrial complex. One of the things that is so important about this video is it gives you, with the BRAIN, the simple acronym B-R-A-I-N, it helps you be able to wrap your head around a simple way to stop, take pause, reflect, and think about, do I really want to do this? Am I being required to do this? Actually, no. Like putting stuff in my body and forcing me to take things, that's not informed consent. So remember, as you're moving forward, whenever you're interacting with people, you have the right to make your own healthcare decisions. You have the right to participate in or to refuse medical intervention. And you absolutely, unequivocally have the right to informed consent. You have the right to understand what is being recommended to you. You have the right to make decisions in your own best interest. And that's really what I wanted to share with you today. So I hope the video is helpful for y'all. If you did enjoy the video, I hope you'll subscribe to me here on YouTube, Patriot Nurse. You can also stay with me and support me on Patreon, subscribe, Star Cryptocurrency, and PayPal. If you would like to put the power into your own hands and you want to be more educated on taking care of yourself and your family's healthcare needs, you can train with me online. I have a couple of options for courses. I have a 4-hour course and then an over 7-hour course. My Foundations of Medical Preparedness course is designed to help people dip their toe in. And then I also have an herbal preparedness course online that really expands and gives you a holistic perspective on how to safeguard your family's health in times of peace and also in times of uncertainty. Hope the video was helpful for y'all. Have a very, very blessed day. For now, it's Patriot Nurse signing off, and I'll see y'all later. Bye.